Andrew was a great character, larger than life. He was very charismatic. He worked very hard. He was CEO of a health company, and he was loved by everybody. He played a lot of sport, and but he was a family man. We have 4 children.
My mum was a wonderful lady. She loved life. She was very vivacious, and I think one of the most important things to her was her family. She felt very, very blessed. She was a avid darts player. She was a manager at a sheltered housing scheme and felt really strongly that the people that were living there needed to have a good social life, so organised lots of events. So she was very conscious of other people's needs.
Simon was a gregarious man, loved his sport, loved his family life, and we were very, very close as a couple.
Mum had a fall which brought her into the main hospital here, and it was really, really noisy and busy and distressing for my mum. She found it really, really hard. But thankfully there was a bed available at Andover, so she had some time there to be looked after peacefully, where they're geared up for that, and it was nice for her to have that peaceful end, really.
He came into Winchester into A&E, and he was referred to a ward, and he basically had the Whipple's procedure at another hospital, and he had an infection. So the infection basically was, he had ascites, so the liver was starting to decline, and he was very, very poorly.
Sadly, Simon was in and out of hospital in the last few months of his life, but the hospital was not suitable for motor neurone disease. He needed a tremendous amount of care, of empathy, and the hospice would have provided that. I know it would have provided that because Andover Hospice was amazing to us. I was travelling to and from Andover Hospice, which was a good 20-25 minutes. I was doing that 3 times a day in a very distressing time, trying to focus on Simon, but also my family as well. Had it been just around the corner, it would have made a huge difference to everyone.
It was really difficult as a family because the family lived locally, and actually, although it was lovely for Mum to be at Andover, it was really, really difficult for us to visit. I've got a 9-year-old who's at school, trying to prepare her for the death of my mum and trying to be, a daughter to my mum, so spending time with my mum and still trying to look after my daughter was really, really challenging. So actually being in Winchester would have made that a lot easier, and also easier for my daughter to come and visit.
We were offered to go and look at a hospice that was, it was about 20 miles out of Winchester. So I and my auntie went and had a look at it, and we just felt that it was such a long way. And I went back and explored the idea with Andrew, who obviously was very, very traumatised and upset anyway, the fact that it had been even suggested that he was going down this route. But at that point I think he needed the right care, and I think the hospice was the right place for him, but we just weren't going to be able to put him there because it was too far away.
Having a hospice in Winchester is hugely important. We think everyone should be able to access specialist palliative care wherever they live, and currently patients who need palliative or end-of-life care have to use services from Andover, Basingstoke or Southampton. For people who live in Winchester, that means a 30 or 40-minute drive, and for some people that's too much. The solution is to be able to provide those services closer to home. We feel that if we were to open an inpatient unit here in Winchester, we could provide that inpatient care, but also we would use that as a hub of a community service that would allow us to go out and help support people in their own homes as well.
It's absolutely essential that people at this very vulnerable time in their lives are given an opportunity to be local, for their families to come and go, for them to receive expert care in a peaceful, quiet environment. And we're exceptionally lucky at this point to have a building on the site of Winchester Hospital, but separate to give people privacy, that is owned by the trust that we can refurbish. It's not in good condition, and it needs to be refurbished to make it purposeful. It's a beautiful building, there's lots of history behind it. We're extremely fortunate to have some space to create into a small garden, and it will enable us to provide 10 individual rooms with ensuite bathrooms. There are lovely big windows, so it's quite a light, sunny building. It's got lovely quiet spaces that we've looked at the plans closely with users as well to ensure that the building is fit for purpose. The beauty of this building is it's in close proximity to the MRI scanners, to the main hospital. That means swift transfer for patients who don't want to be in hospital at this very crucial time in their lives. And for some, home might be the option. They may come into the hospice for a few days. They then might be discharged home with support of a home care team or a hospice at home care team that can provide specialist care 24 hours a day.
Also, the benefit of obviously the hospice that we're planning here is the hospice at home service, because mum's wish really was to die at home, but unfortunately we weren't able to do that because there weren't the services available to do that. So having a hospice here would be absolutely amazing.
If there had been a hospice in Winchester, I think it would have made all the difference for the last few days of Andrew's life. The opportunity for the children to go and be with him and just have it experience some time and space to really come to terms with what's happening.
End-of-life care is core NHS business, and that will continue to be the case. The significant difference is that this money that we're raising will refurbish a building to provide the setting and the extra quality of care that people need to receive at this vulnerable time in their lives. More space, more nurses per patient, attention to detail, providing some of the more home-like aspects of the hospice that the hospital is unable to provide.
We've had one legacy which has been amazing, and we're getting lots of support from Rotary in Winchester, from the local community, from people doing small events to large events, from a Christmas ball to a bridge tea. But we need more, and we need more help, and we need more money coming in so we can refurbish the building for our patients.
Any hospice thrives on the community support it receives. We will have lots of volunteers, I hope, working in the hospital. I think it will become a central part of the community. Local bodies will help support. And we need your volunteering skills, and we also need your money. If we're really honest, we can't refurbish this building unless we raise the money that we need.
It's hugely important. I think every patient should be entitled to have access to these sorts of services close to home. Palliative and end-of-life care should be part of our core service, and particularly now with the ever-ageing population, we should be able to provide these services for people.
None of us like to think about passing away and what happens at the end, but actually you never know when it's going to be you that's affected by cancer or a life-limiting illness. So actually it could be you or your family, so it's vital that we all get behind it and support the hospice.
Having a hospice in Winchester is one of the most important aspects that I can think of for myself and for my children. It is somewhere local that you can pop in and you can share.
Until your family is struck down by a terminal disease, no one knows how important a hospice can mean to your family. A local hospice is of the utmost importance to the people of Winchester. Please, please help us support this very worthy cause.
Being able to provide these sorts of services closer to people's homes would have such an impact on patients and their loved ones, and we want to be able to support them. But we can't do that without raising the vital funds, so please do help.